Welcome, Ashley and Jenny. We're going to be talking about improving access to cardiac rehabilitation and chronic care management through digital health. And as Dan mentioned, Ashley and Jenny are with Recovery Plus. So welcome and thanks for your time to join us today. To kick it off, I would love to give you both an opportunity just to give a quick intro, and then we can jump into the topic.
Yes. Hi. So I'm Jenny Martin. I am the Chief Nursing Officer with Recovery Plus. I have actually been with Recovery Plus for about 7.5, 8 years. My background is fairly targeted with being in cardiac rehab, pulmonary rehab, as a nurse practitioner and a nurse over the last about 10 to 12 years. And so Ashley, I'll go ahead and let you introduce yourself.
Hi, I'm Ashley. I am an occupational therapist. I've worked pretty much across the continuum of care, inpatient, outpatient, ICU, CDU, you name it, and joined Recovery Plus about a year and a half ago at this point as the VP of Partnerships. Recovery Plus we are a chronic care management, remote patient monitoring, and cardiac rehab company. As Dan mentioned, we are providing all those services right from the comfort of the patient's home. So it includes one-on-one exercise sessions, one-on-one dietary consults, one-on-one care and treatment with APPs. So as Jenny mentioned, nurse practitioners, PAs, you name it. So really focusing on increasing access to care and providing patients with a comprehensive program that they can do all of their rehab, preventive care, maintenance care right from the comfort of their home.
That's fantastic. And I think it's really an amazing trend that I hope to see continue to boom. So for this topic, let's start a little bit with, the big picture and the why of this and the problem to solve. What gaps do you both see in today's cardiac rehab and chronic care models that digital health can help fill in a very unique way?
Yeah, absolutely. So we know that cardiac rehab works. We know it's efficient. We know it's effective. We know it keeps patients out of the hospital, preventing hospital readmission rates. But it is wildly underutilized. So about 80% or so of individuals who are eligible for cardiac rehab do not go. And there's a number of reasons why they don't go. There are personal reasons. There's obviously barriers to care, ranging from geographic location. So if they're in a very rural area, there may not be a cardiac rehab nearby, or it might be a transportation issue. But even for those in an urban area, there's often limitations due to number of facilities or significant wait lists. We found that even here in New York, there's a number of cardiac rehabs, the wait list can be up to 2 months. And with that, of course, comes like time constraints, financial constraints of even simply the cost of getting there, but also having to take off work to go to cardiac rehab 3 days a week, drive there, participate, drive home, child's care, whatever it may be. So geography, time, financial, and even eligibility criteria, right? So there's only a few diagnosis codes that are accepted to cardiac rehab. So that is another significant barrier. And digital health really allows us to increase access to care, addressing all of those barriers by bringing the care directly to the patient's home. And then from the chronic care management standpoint, it opens the door for individuals that haven't necessarily had a cardiac event, but have the risk factors like hypertension, diabetes, obesity. So getting them in the door, even though it's called chronic care management, it is serving that preventative care in order to prevent future complications down the line. And the digital health further helps us get it in a timely manner and get patients off of the right track.
Yeah, that's great. I mean, because there is a real need out there that goes beyond just cost and access. It's
Absolutely.
Life getting in the way of being able to actually get to a place where you can get the rehab. It's great to have this opportunity that we have with technology and digital to help, bridge some of those gaps and some of those challenge areas. And from like a clinical perspective in the work that you both are doing, how has remote patient monitoring changed the way that you're providing care?
So I feel like from a clinical perspective, one of the things that it has done is allowed us to take a more proactive approach. And it's actually a data-driven proactive approach. So we're able to utilize cellular devices like a blood pressure machine, weight scales, and these give us real-time data. So with this, we can intervene much quicker. So it kind of takes away that, are they really weighing? Are they really checking their blood pressure? Did they tell me this number from 3 days ago? So we're actually able to intervene much quicker. We're able to sometimes intervene at home, primary care office, cardiology office. We can actually enhance medication compliance, because if we do see a slightly elevated number, which is much more rapid than if we wait till they come back into the office, we can start looking at, did you take your meds? Do we need to increase? Are you having trouble with access to getting your meds? Because of all of this, from a clinical standpoint, we actually are reducing overall healthcare cost. And when we look at that long term, it's reducing the burden on the system, whether that be rural health and the limit to care. There's, wait times for even just primary care offices in rural health settings are sometimes 6 months. So we're able to reduce that burden on the system because we're able to monitor real-time data.
Well, those are very important impacts, and people really are always looking at those costs. So I think it's a really important point and a great opportunity. As we talk about, the clinical perspectives and the technological opportunities, we don't want to forget about the fact that these things together are really about improving a human being's life and outcome and quality of life and ability to live their lives the way they want to. It's about that patient experience. So based on the work that you're doing, by leveraging these sort of digital technology strategies in the home, how are you seeing that impact the human experience? And are you seeing an improved experience, a more engaged patient with the approach that you're taking?
Yeah, absolutely. And I think, it's pretty basic, right? I feel like one of the strategies that we've really utilized and really, really find great value in is just simply building the trust. Our healthcare system is so incredibly complex. It is so confusing. There's so much out there, whether it be providers, even digital health companies. Like, what sets you apart? What makes a patient trust you versus like logging onto an app and then using it for 2 weeks and then being done with it? So I would say that building the trust not only amongst the patients but amongst the providers as well is really essential. Once a provider knows that we're providing comprehensive care that they trust and they can talk to the patient about it, that is definitely the first step. And then the second step is really showing the patient that we're there for them, we hear them, we're listening to them, and being able to build that trust and build that rapport. We're able to show them that, like, we can consistently give you value through this personalized care. So not just showing them that we know what we're doing, but showing them that we're listening and that we're adapting the program based on their needs every time we see them. So our patients are getting consistent exercise physiologists, dietitians that are doing their initial evaluation, setting up a plan for them, modifying it as they need, to really ensure that we're holding them accountable, but we're also providing them consistent value, personalized care throughout their duration of their time on the program. And then from, I would say, like a digital health perspective of a strategy is, again, pretty basic, but ensuring ease of use, right? Nothing complex, intuitive design of the apps or of the tools that they're using, and also integrating it with like familiar devices. So a lot of patients are already using the cell phone that they have, or an iPad or a computer. Like Jenny mentioned, we provide all of our patients with blood pressure cuffs, and they're simple. There's one button, it's cellular. All they have to do is put on their arm and press start. And the information is automatically uploaded to our system. So ease of use, I think, is definitely a important strategy just to ensure compliance and keeping it like we said before, easy part of their day-to-day, and supporting it and falling into their habits and their routines, not just a random pop in or that they're just opening the app. So we're there for them. They trust us, and it's easy.
Yeah, I agree. I mean, I think anything where, you be where they are and make it as easy for them, give them the easy button is really the sweet spot. But then that personalized adjustment makes the individual feel listened to and heard, and gets them more, more engaged, more willing to really be a part of the work that needs to be done as a part of the program. So I think that's a great way to think about it and deliver it. So as we close out and you think about the work that you're doing in this space, in the cardiac rehab space, this question is for both of you. If you each had like a magic wand, what's one barrier that you'd remove to accelerate digital transformation in this cardiac rehab space? And what excites you about the future of digital health in chronic care management?
Yeah, so I'll start on this one, Ashley. So the magic wand. I love this question. If I had a magic wand, the barrier I would remove to be able to accelerate this digital transformation in cardiac rehab would 100% be the limited and inconsistent coverage of chronic care management services and cardiac rehab services by insurance. So we've seen the evidence. We know that these rehab programs are improving patient outcomes. We know that chronic care management is reducing hospital readmissions. We know it's lowering those long-term healthcare costs. However, we are still having some insurances that just are not providing adequate reimbursement, or occasionally no reimbursement. And that is where, if I could just wave the wand and make that barrier go away, I would. We know if we could just mandate comprehensive insurance coverage for in-person digital rehab and chronic care management, we know that we could dramatically expand the access to these services, specifically for underserved areas, rural populations, and our patient population that doesn't have access to transportation. It would incentivize providers to go ahead and adopt these digital scale solutions. And then it would enable more personalized data-driven care. So overall, that is what I would definitely improve.
And that makes a lot of sense. And Ashley, like, what's exciting you when you think about the future relative to digital health and the work that you're doing in the rehab space?
Yeah, I think Jenny touched on this a bit before, but utilizing the data from the remote patient monitoring to create personalized care while also increasing the access to that care. So I guess it's really just expanding the access, it's patients that are in these like rural areas. It's not that that this is an option. It's like it's for many of them, it's the only option. So not only getting out there, but getting them personalized care. And I think, really focusing also on that seamless like integration from a digital health perspective with other care teams to make it a collaborative approach. So getting patients in rural areas the care that they need, making sure it's personalized, but also still keeping in mind that, these patients came from a primary care physician, they came from a specialist, and using the digital health tech platforms or providers to really communicate what is going on with this patient so we can work it as a collaborative method to really cover all the bases.
Well, I think those are great things that I hope we are going to see in a not too distant future. But in the meantime, thank you so much for the work you're doing in this important space and really delivering a very customer-centric, patient-centric approach to healthcare, leveraging technology and digital health. So I think it's a great case study. So congrats on all your success, and thank you so much. Would love to talk with you again sometime. But Jenny and Ashley, have a wonderful afternoon. Thank you so much.
Thank you.
Thanks, Amy. Have a great day.